During COVID-19, the primary challenge for decision makers in ASEAN wasn't a lack of data, but data that was fragmented and slow to utilize. Manual reporting led to delayed police response, even as case mortality trends shift rapidly. Those most affected were public health analysts and policymakers who require a single, consistent regional view to determine when to initiate intervention, communicate risk, or coordinate across borders.
We developed a system called ASEAN COVID-19 Decision Support and Surveillance Platform, or ACDSSP. This system is used by public health analysts and policymaking teams at the Ministry of Health to monitor COVID-19 trends across ASEAN countries in a consistent and timely manner. From an architectural perspective, the data originates from the OWID COVID-19 dataset, which is then processed through a Python-based ETL pipeline that performs data extraction, ASEAN country filtering, data cleaning, and transformation. The processed results are stored as versioned clean datasets and visualized through a Tableau dashboard. The dashboard presents decision-oriented indicators such as KPIs, trend analysis, maps, and interactive filters, compared to static reports or manual analysis. ACDSSP offers clear advantages: faster updates, greater cross-country consistency, and direct support for public health decision making.
Now, let's demonstrate the actual implementation directly in Google Cloud. The old dataset is retrieved and processed using a Python ETL pipeline to filter for Asian countries, clean the data, and add table columns. The output is saved with a timestamp to serve as an audit tile. This ensures the pipeline can be executed routinely and the dashboard remain continuously updated. This specific output file serves as the input for our Tableau dashboard for trend monitoring.
For a system that is truly deployable, a dashboard alone is not sufficient. Therefore, we added a REST API layer so that the clean and validated indicators can be consumed by other systems, such as government ministry systems, global partners, or a national level dashboard. In this implementation, the summary endpoint returns key indicators aggregated by date in a standardized JSON format. This design demonstrates interoperability as external systems can access and the required information without any direct connection to the underlying database. By exposing data through an API rather than raw tables, the system supports secure data exchange, scalability, and integration across platforms. The data shared via this endpoint is aggregated and non-identifiable, which significantly reduces privacy risk and makes it suitable for cross-organizational data sharing. Overall, this REST API layer shows that the system is not merely a visualization tool, but a production-ready platform capable of supporting real-world data integration, governance requirements, and collaboration across institutional boundaries.
The enhanced decision value lies in the ability to observe trends and identify priorities. For example, if cases are rising while the stringency index falls, policymaker can consider tightening restrictions. Or, if deaths per million increase while the vaccination remains stagnant, the priority shifts to vaccination intervention and risk communication. Without this system, analysts would need to compile data manually and compare across countries one by one. Trust is the key to adoption. Therefore, the pipeline generates an automated data quality report checking for missingness, duplication, negative values, and the last update date. With the transparency of the OWID source, quality checks per run, and a version output audit trail, organizations can trust this dashboard for regional surveillance. In 2 to 5 years, it is realistic for a system like this to become a component of cross-country monitoring and early warning systems. ACDSSP is a system that can be operationalized, integrated, and trusted, not merely a demo dashboard. Thank you.